Hello and welcome to my video. My name is Mayela and I make videos on my life as a nurse, thrifting, and travel. If those are things that you are interested in, please consider subscribing. I am actually trying to reach a goal of 500 subscribers by July 2020. So if you do enjoy this content, subscribe, it's free. Today I'm going to be doing a video on related to nursing. So as you see in the title, I'm going to be comparing bedside nursing to outpatient or office nursing, whatever you want to consider it. I have just a quick background about me. I am a registered nurse currently working as a public health nurse in field medicine, and I've made tons of videos on day in the life of a nurse, day in the life of a public health nurse. So if you want to see a little bit more of what it is that I do, go ahead and click those videos. I'll go ahead and put them in the description. I have a whole playlist. But I am a public health nurse. I have worked in the bedside. I have a few years experience working on the bedside. So now I work out in it's a little bit different, but we'll say I also have clinic experience. So we'll compare the clinic experience with bedside experience. I have been licensed for the last 10 years and I have held a variety of positions ranging from the bedside all the way to clinic and now field medicine. Let's get right into it. I do have a notebook right here, so you're going to be seeing me looking down here and there. I just want to reference on my notes. There's quite a few things that I want to make sure to mention and not forget, so you will be seeing me looking down. So the first thing I wanted to talk about is the schedules. So working in the bedside at a hospital, say it's a hospital, a SNF, a subacute, anything like that where patients that admitted and they're not leaving when nurses are needed 24 hours a day. The schedules in that kind of setting are sometimes 12-hour shifts or 8-hour shifts. Nurses are needed 24 hours a day, so there are different shifts. Nurses can work night shift, evening shift, or day shift, and weekends. So in comparison to working in a clinic, usually when I worked at a clinic, we were off on weekends and holidays. One of the clinics that I did work in had Saturday appointments available for patients. So in that regards, you could possibly be working on a weekend, but usually on those Saturdays we would get out a little bit early than the normal times. So a big difference of working at the bedside as opposed to a clinic or office RN is the schedules. Clinic setting, you're usually working business hours, so it could be 8 to 5 or something around there. And like I said, you would get holidays and weekends off, as opposed to the bedside. There's not much flexibility on time off, since patients are there, like I said, all time, and nurses are needed 24 hours a day. In the bedside, there is definitely way more opportunity to do overtime. I remember when I was working in the bedside setting, I would always have to do overtime. Sometimes it was mandatory. Sometimes if the nurse for the next shift called in sick and they couldn't find a replacement, guess who has to stay there? You. So I would have to stay there. Sometimes I would do a double shift. So that could be a pro or a con for you. The ability to work overtime. In the clinic setting, there is actually not that much opportunity to work overtime because, like I said, the hours are pretty limited to business hours, and it's usually weekdays. So that's something that if you're considering making a switch, maybe from bedside to clinic or clinic back to the bedside, those are definitely some things to consider with your lifestyle. If you have kids, if you have a family or other responsibilities, definitely take that into consideration, because I know in the bedside you can't just request to work to have weekends off. That wouldn't be fair, and most places wouldn't accommodate that for you. So schedules are one of the biggest differences in the two different positions. The next area that I wanted to discuss or compare kind of settings that you can work in. So if you're working at the bedside, mostly you're going to be working at a hospital, and when working in a hospital, you can work in so many different units. You can work in an ICU, a med surg, even emergency room, a lot of different things. And if it's not in the hospital, bedside is also considered your SNFs and your subacute facilities. When you are working away from the bedside, there are also a lot of different things that you could be doing. So like I mentioned, my experience, I worked at a clinic, so it's a primary care clinic. They did have some specialties there too. A specialty clinic, it could be an urgent care, OBGYN, so many different things. Those are the kind of settings that you can work in. You can even work in an outpatient surgery. You can be a case manager, RN. There's so many things that you can do. And actually my goal for my videos that I make about nursing is just to provide insight or education to people, maybe new nurses, that you do not have to work at the bedside. It is ingrained to us in nursing school that once you graduate, that nurses, the only place nurses can work is at the bedside. And I'm here to tell you, no, it's not. There are so many different avenues that you can go to with a registered nurse license, and I'm here to show you one, which is my non-traditional role in field medicine. In the bedside, I would say things could be a little bit more stressful. You are having things that are time sensitive, so medications that need to be given with a short period of time or short window period, and if it's not given at that time, it can be considered late and it can be detrimental to somebody's condition. So at the bedside, it can be a little bit more stressful or a lot more stressful. You are dealing with life or death situations. Sometimes people can be very sick and require a lot of your skill and knowledge to keep them alive. As nurses, you know that we are with the patient 24 hours a day. The doctor or nurse practitioner usually only comes in for a few minutes to do their rounds, input some orders, but as a nurse, you're the one who actually is keeping the patients alive and well, and you are the eyes and ears for the doctor and everybody else in the team. So on that regards, bedside nursing could be pretty stressful. We're also working with the interdisciplinary team. So like I said, you're working with the MD or the nurse practitioner or PA. You're also working with physical therapy, occupational therapy, speech therapists, all kinds of therapists, all kinds of people. A radiology will come to the room, take the patients. So in the bedside setting, I would say you are interacting a lot more with other members of the healthcare team. So that is one of the major differences. In the clinic setting, you are also working with a team, but usually is a lot smaller team. As a nurse, I know that usually we would be divided into groups. A RN would be assigned to a provider. That could be a nurse practitioner or a doctor, and they would also be teamed up with a medical assistant. In bedside nursing, it is definitely more physically demanding. You are lifting and pulling and transferring patients. So I know that there's a lot of physical injuries that happen to nurses in the bedside setting. In the clinic setting, not so much. Most of these patients are walking in. They are pretty healthy. For the most part, they're pretty healthy and they're just coming to see the providers for regular checkups, or maybe they have things like diabetes or high cholesterol or hypertension, and they're getting regular checkups with the providers. So it is definitely less physically demanding to be working in the clinic setting or office setting as opposed to the bedside setting. Something else that I wanted to mention about the bedside is that when working there, you are able to stay up to date with all the newest treatments and maybe new skills and medications are coming out. You're doing a lot of hands-on skills in the bedside setting, things like IVs, maybe blood draws if there's no phlebotomist available, wounds, incision care, all kinds of drains, all kinds of pumps. So there is a lot of nursing skills that you are using at the bedside setting. But I would say in the clinic setting, you are also using different skills. Some of them may be the same, some of them not so much. I know that when I was working in the clinic, a lot of the things that I was doing was phone triage. So patients would call and usually they would say that they want an appointment because these symptoms are happening. So usually the receptionist would transfer it to the RN that is assigned to that patient's provider. And as the RN, I would get the call and speak to the patient, get a brief history, see what's going on with them. And after speaking with them, I would determine if this is actually an emergency and they need to go straight to the emergency room, if this is something that they need to come into the office to be seen right away that same day, if it's something that can wait a few days for the next available appointment, or if it's something that they can monitor at home and follow home care instructions. So I would also do a lot of hands-on nursing skills. So I would do phlebotomy, so a lot of lab draws, no IVs in the outpatient setting, but I would do lab draws, injections like vaccines. It could be medications, things like Depo or other medications that patients were on. I would give medications, oral medications, not too frequently. Sometimes I would have to give insulin if the patient came in and their blood sugars were just really high. Sometimes the provider would order insulin, would have them wait there and see how their blood sugars respond. We would also do a lot of wound care. There's some patients that had ongoing wounds that needed to be dressed every few days. A lot of wound care was going on in the clinics. There are definitely a lot of skills that I was still using. Like I said, maybe it's not the exact same ones as a bedside nurse, but I was still able to do a lot of nursing skills, and you don't lose them in the clinic setting, at least in my experience. In the bedside, you are seeing patients usually in some of the worst days of their life. So a lot of them are in vulnerable positions. A lot of them are scared or maybe they're angry at the situation that's going on. You do have to deal with the families that come along with all the patients. In my experience, working with families can be pretty challenging, especially all the dynamics in between everybody. You don't know what kind of history the family member has with your patient. So it can be very difficult, on top of everything else that you're doing, to have to take care of the family members or the situations going on between them. I would say in the clinic setting, usually people do come alone. Sometimes they might come with one person, maybe their spouse or a child. But for the most part, the people you are seeing in the clinic setting are pretty healthy. They're out and about in the world and they're able to take care of themselves and ambulate. So I would say seeing patients in that condition is way better than seeing them sick. Although I feel like at the bedside, I would create much deeper connections with the patients. You are seeing them in vulnerable situation, so they, not all the time, but they can really appreciate the care that you provide for them. And sometimes they are pretty grateful. So I do kind of miss the connections that I would make with my patients, or seeing a patient come in pretty sick and take care of them for a few shifts and then seeing them go home a lot better. That is something that you don't really get to see too much in the clinic setting. Something else that I wanted to talk about at the clinic setting is the autonomy that nurses can have. Like I said, a lot of times we're making a lot of the decisions on the patient's care. We do nurse visits. So those are visits that are scheduled with us as the RN, and we assess them, and there are protocols available for certain situations. So there are medications, say one of them, an easy one is cough. So if they come in with a cough, you assess them, do also take the lungs and do all that kind of stuff. And there are protocols where there will be orders, standing orders for them, so we can actually go ahead and send those orders to the pharmacy. So that, and there is a lot of autonomy in the clinic setting. I am no longer working in a clinic setting. I'm now working in as a public health nurse in field medicine, and public health nurses take care of whole communities. My community that I take care of is the farm workers in a small rural town, and I actually live in California. So it is a small rural town on the coast in California, and I work pretty much independently. We see them out in the fields and the farms, and it's pretty cool. I have never heard of any other position like the one I have now, and absolutely love it. Now, having worked in the bedside and clinic setting and now in the field medicine, I don't know if I would go back to the bedside, just because of a lot of different things. I mean, for my personality, I think that the clinic and field nursing works best. It could be a lot more stressful, a lot of physically demanding, less flexibility with time and time off. Like I said, one of the could be a con or a pro for you is that the opportunities for overtime in the clinic setting are not that many, but that is okay with me. I prefer to have my time more than money. So those are the things that really stood out to me when I went and compared the bedside with the clinic setting. Let me know if you have worked both kinds of areas. Did I miss anything, or what would you add to the list of things that I had? I think all nurses are valuable. Don't ever let anyone tell you that just because you don't work in a particular setting that you're not a real nurse. I actually did get that a lot just within my career. Just because I didn't work in the hospital, people told me that I'm not a real nurse. So I think that is just ridiculous. All nurses are valuable, and all the different settings that we work in make differences in people's lives, and we need to be in every single setting that nurses exist in. So that is all that I have for today. Please let me know if there is anything else that you would add to my list of comparison in the different settings, and if you have any other video topic ideas in relationship to nursing, let me know in the comments. I love making these nursing videos, and I think most of you like nursing videos. I do make videos also on thrifting and travel. So if you enjoyed today's content, please subscribe. Like I said, I'm trying to reach a goal of 500 subscribers by July 2020. So help me on my journey, and I will see you on my next video. Thank you so much for watching. Bye.